Hello and welcome to Arirang TV's special coverage of the COVID-19 pandemic. I'm Min Sun-hee. Having started in Wuhan, China, the coronavirus is now a global concern, with government officials and medical experts worldwide working around the clock to contain the contagion. In today's episode, we bring you the latest on the situation and commentary on the economic repercussions of the COVID-19 outbreak. To start us off, we have in the studio Kwak Soo-jong and Arirang. Welcome.
Hello. Thank you.
So we'll start off with you. I understand we have 100 new confirmed cases here in Korea.
That's right. For 3 consecutive days, we had cases in the double digits. But as of 12 a.m. Wednesday, the official number of confirmed cases stands at 100. So let's take a closer look here. The total number of confirmed cases stands at 9,137. 6 more COVID-19 patients died between Tuesday and Wednesday night. But another case has been announced separately, bringing the total number of deaths to 127 now. Around 220 people have completely recovered from the virus Tuesday, with a little under 5,300 under quarantine or in treatment. Now, taking a look at the numbers by region, we are seeing a new trend now. We are seeing the metropolitan area, which includes 13 new cases in Seoul and 21 in nearby Gyeonggi-do province, as well as 1 in Incheon, now amount to 35 combined, which is more than 19 new cases in Daegu and Gyeongsangbuk-do province combined, which we know has been a long-time epicenter of the outbreak here in Korea. So that is a good sign, but also raising awareness in other regions. Now, the decrease of cases in Daegu to below 20 is the first time in more than a month now. So that's when the community infection was just starting there in that region.
I see. What about imported cases?
Well, 51 cases out of the new 100 are related to infections from abroad, according to the Korea Centers for Disease Control and Prevention. 34 cases were confirmed during the strict measures at the airport, with 28 patients being Korean nationals and 6 foreigners. Now, authorities say overseas cases are on the rise, along with a rise of entrants, and that's probably because many South Korean nationals are returning from overseas because they are concerned of the worsening situation abroad. Now, with concerns of a surge in patients not only in Europe but the U.S., the KCDC earlier announced to enforce measures for arrivals at the airport for people arriving from the U.S., and I think Arirang will talk about this later further. Now, meanwhile, health authorities are inspecting social distancing practices across the country and said as early as this week it will discuss the establishment of an organ that's comprised of government officials, experts, and citizens to provide sustainable guidelines on social distancing.
Right. So you spoke of the situation worsening elsewhere around the world. Do give us the figures there.
All right. Well, the number of total cases has exceeded 400,000, according to data compiled by Johns Hopkins University, and more than 18,200 people have died of the virus, according to that data. Now, China's cases are tallied at more than 81,000, but with its drastic drop in infections, has now eased its lockdown in Hubei province, which is the epicenter of the virus. Italy's cases are nearing 70,000, followed by the U.S. with 53,000, and more than 30,000 are reported in Spain and Germany. Now, meanwhile, the Italian government predicts the total accumulation of cases in Italy to exceed that of China within a week, and also the death toll there has surpassed that of China 5 days ago. The health system is on the verge of breaking down, and Germany, meanwhile, has offered to take patients in critical condition from Italy, calling for solidarity across borders in Europe. The World Health Organization also sees the U.S. to become the next epicenter of the virus, with cases likely to exceed China's cases by April. Now, one of Washington's latest moves to contain the virus is an order to anyone who recently has been to New York City to self-quarantine for 14 days. And in LA, we saw the first teenager die from the virus. Meanwhile, elsewhere, there are a lot of sporadic cases that we haven't really been talking about here on the program. But for instance, in Southeast Asia, Laos reported its first 2 cases recently, and Singapore its first 2 deaths. So the spread is not over. It is continuing to countries that have not been affected recently. Meanwhile, neighboring Japan has currently a little less than 1,200 cases. The countries that's now not only hit by the virus, but of course also by an official postponement of the Tokyo Olympics, as it also canceled its Japan leg of the torch relay that was scheduled to start on Thursday. And I think Aram is going to talk about the 2020 or now 2021 Tokyo Olympics.
Yes, he is. Before he does that, though, Aram, I understand that our South Korea's quick response to the COVID-19 pandemic has gotten the attention of the US, and President Trump has asked his ally for help.
That's right. So President Trump asked President Moon Jae-in for some medical supplies to help fight the coronavirus outbreak in the US. Now, it wasn't immediately clear what medical supplies Trump was referring to, but it is most likely to be the testing kits, which have been under the limelight across the globe here due to the scale of how South Korea has been testing coronavirus patients. And Moon responded by saying he will provide maximum support if it is available, if he has any supplies to spare. And the request came during a phone call between the 2 leaders on Tuesday. Now, that phone call was apparently made by an urgent request from President Trump. And during that phone call, Trump praised the South Korean testing program, which has helped contain the outbreak here in Korea. Now, Moon did point out that the medical supplies, as with all medical supplies being exported or imported, do have to go through the US FDA approval. And Trump responded that he would seek the FDA approval within a day. So we might be hearing news of that soon. And the US, meanwhile, has been under fire for somewhat slow and shaky testing, but it has scaled it up after much of those criticisms.
I see. So I mentioned this too, but South Korea has been implementing stricter quarantine measures for those arriving from Europe. I understand this will be extended to those arriving from the US as well.
Yeah, that's right. So speaking of the US, now we know that Europe is now a COVID-19 hotspot. So that's why Korea has been taking these precautions and these extra stringent measures for people coming into Korea from the continent. They're required to undergo strict quarantine measures and testing once they arrive. Those measures, as I say, have been expanded to the US, and all people coming from America will be required to self-isolate for 2 weeks, regardless of whether they show symptoms or not. That includes Korean nationals as well, flying in from Korea. That's because most COVID-19 cases from abroad have actually been Korean nationals on business trips or on vacation or holidays. And if they do show symptoms during the self-isolation period, they will get tested by local health authorities and more action will be taken. And this latest move comes as the Prime Minister Chung Se-kyun called for such measures, saying that these measures need to be expanded to elsewhere other than Europe.
Right. The Tokyo Olympics has now been officially postponed. It took a while for that decision, though, Aram.
It did, and the IOC, as we know, had been adamant that the Olympics would go ahead as scheduled, but it had been under immense pressure from athletes and Olympic governing bodies across the world to postpone the event over these COVID-19 fears. And since then, the IOC had softened its stance, saying it's going to consider its options for 4 weeks, but that announcement was only made 2 days ago. So within the space of a couple of days, the IOC has definitely now decided to postpone the Games to next year. And the decision comes following talks between Japan's Prime Minister Shinzo Abe and the IOC President Thomas Bach. The pair agreed that cancelling the event would be out of the question, so they won't be considering cancelling the event, but the postponement was the most appropriate choice, according to Thomas Bach. The event will still be called Tokyo 2020, funnily enough, even though it is rescheduled to the year 2021. And also, this postponement will deal a huge blow to Japan's economy as well, because it has spent almost $12 billion on the Olympics so far. And Goldman Sachs, one of the banks, said that it will lose probably about $4.5 billion in consumption and domestic economic impact.
I see. Right, well, it's a little after 2 o'clock in the afternoon here in Korea, and we take you now to the regular briefing by the Central Disaster and Safety Countermeasure Headquarters on the latest facts and figures about COVID-19 in this part of the world. Well, we've just heard that they'll be there in a few seconds, I see, so we're still waiting for them to come on stage.
Now let us begin our regular briefing for March 25th, Wednesday, on the coronavirus outbreak here in South Korea. As of today, midnight, the total of confirmed cases stands at 9,137. We have about 227 imported cases from abroad, and 223 more people have been discharged, with the total now standing at 3,730, which amount to about 40% of the confirmed cases. Yesterday, the confirmed case rose by 100, and nationwide, 82.4% were related to cluster infections, and the remaining 15.1% was related to sporadic outbreak, as well as those going under investigations. And from today, we have changed the design of the table of the confirmed cases. About 2.5% of all of the confirmed cases were related to imported cases, and 82% were related to cluster infection, among which 56% were related to Shincheonji Church of Jesus. And other 15.1% were related to religious group infections. And also we found out that 0.5% were related to imported cases. And of the 100 cases that were confirmed yesterday, 51 were related to imported cases. In Seoul, we saw 8, and in Busan, we saw 4, and also other regions, including Busan, Gyeonggi, and Jeju, have all seen a rise in imported cases. And let me go into the breakdown. As for the Seoul City Gurogu District Call Center, there were no more cases confirmed and reported. From the 8th of March, a total of 159 cases have been confirmed, and they all reside in the areas of Seoul, Gyeonggi, and Incheon. So we cooperated with these 3 metropolitan areas to provide the contact tracing. And we also identified their contacts as well. And from the buildings, the 40% of the cases were related to the 11th floor, while 7% was related to 10th floor, and 9th floor was about 4%. And there were no outbreaks reported in other floors of that same building. And of the 226 family, about 20% of them have been infected, and this includes 8 who have no symptoms. And up until now, we still believe that we have not yet witnessed asymptomatic patients who have been confirmed in relation to this call center. And in Daegu, we have conducted and completed all of our enumeration investigations regarding the nursing hospitals, and we are also conducting our enumeration investigations for the mental hospitals, and about 80% of them were all tested negative. And in Daegu, at the Hansarang Nursing Hospital, we have 9 more cases, and that makes our total to 111. And very recently, we are seeing a surge in the number of imported cases. In order to effectively curb the spread of the imported cases, we need to carry out and implement a very much intensified entry entry measures as well as a strict self-quarantine. And 90% of those who came from US and about 90% of those from Europe were all Korean nationals. And from the 100 on-day increase of the confirmed cases, 51 were imported cases. Majority were from the Europe, including about two dozen people. And this was followed by US and other Asia regions, including China. And we also identified 34 more cases from the airport quarantine. And starting from the midnight of 27th, we will be intensifying our intensified entry measures against all arrivals from the US. Such a measure comes as we are witnessing a surge in the confirmed cases in the US. And regardless of their nationals, all of those with symptoms will be tested directly and immediately at the airport. Once they are tested positive, they will be sent to hospitals or live treatment centers. And if they are tested negative, they will be put on self-quarantine for the next 2 weeks. And for foreigners without permanent residence, they will be going under self-quarantine as well. This also applies to Korean nationals as well. And we will be considering and monitoring very closely the outbreak that is happening in the US, and we will have to carry out enumeration investigation if it's needed. And foreigners without permanent residence will be actively monitored, and they will be moved to the temporary shelter places. And the entry special entry measures will also be put in place to those from Europe and the US, and no financial subsidies will be provided for these people. And we will also intensify our quarantine measures and guidelines for self-quarantine. They will be notified and they will have a notice of self-quarantine. And in case of a breach, they will be facing penalties or fines of up to 10 million Korean won. And they would also be mandated to download a self-quarantine application, and they will be monitored by the local authorities. And the KCDC also urges the international travelers to follow our guidelines as well. For those who are coming in from US and Europe, please do take part in our quarantine measures. And in order to curb the further spread of the virus to your families, to your friends, and to your co-workers, please do keep the self-quarantine measures. And we once again urge that you participate. And for those of you who are coming from elsewhere, we ask you to stay at home for the next 14 days and refrain from social contact, and please keep personal hygiene measures. And if you have any suspicious symptoms, please ask our call center 1339 and ask a local public health center or visit a screening facility. And when you visit the screening facility, you should arrive wearing a mask and in your own car if necessary. And employers are also advised to ensure that employees returning from international business trips do not come to work for the first 2 weeks upon their return. And the KCDC also highlights the importance of disinfection and sterilization, and we will also provide you guidelines for this. They will be made into card news so that they can be easily visible. First of all, you should wear your gloves, masks, or aprons, and the sterilizer should include 70% alcohol, and it should include 30% of house domestic use of bleach. And you should wipe and clean the frequently touched surfaces as well as objects. And between your disinfections, you need to have regular ventilation as well. The KCDC witnesses a global pandemic of the coronavirus, and therefore we are still witnessing sporadic sporadic outbreaks here in the country. And that is why we are asking you to participate in our intensified social distancing measures. We ask you to refrain from going outdoors. If it's not essential, please refrain from going outdoors and stay at your homes. And while you are having dinner or lunch outside, please sit with a certain distance between each of you, and please wash your hands thoroughly with soap and water. And we also ask employers to implement various methods of minimizing person-to-person contact for employees, such as working from home, as well as flexible hour systems. And for those who have symptoms, they need to be advised not to show up to work. And even though they develop symptoms during the day, they should be sent home immediately. We also have an attachment number 3, which details the mid-term analysis of the investigation that were carried out at the Seoul City Gurogu District call center, which I just touched upon a little bit. Well, one of the most highlight is that among the 120 people who were working at the 11th floor, about 90% were infected, meaning that this was the floor with the highest ratio of infections. And this was because this business was very prone to infections because they were seated very closely, and the system did not have regular ventilation. And other floors had a very low or no infections. And secondary infection, including their family members, we witnessed that family member contacts and infection was about 15%, which was higher than other cluster infections, which hovered around 8%. And as mentioned before, of the 97 people who were infected, a majority of them were asymptomatic patients, and this is why we saw a large ratio of secondary infection as well. And considering the feature of the call centers, where there are a lot of droplets, and we could guess and witness that the droplet infection was very high, and it showed an infection rate of about 45%. And as we are still witnessing such cluster infections around the high-risk facilities, and therefore we are identifying the patients at an early stage, and these are still being intensified going forward. And we once again highlight that all of the people-to-people contact should be minimized at all places. That's all for me. Thank you very much.
Right, that was the latest on the COVID-19 situation in Korea by the Central Disaster and Safety Countermeasure Headquarters. And while Korea appears to be entering a relatively, I stress the word, relatively stable condition, this is unfortunately not the case in Europe. In fact, over in Spain, which stands as the second hardest hit country after Italy, corpses of the elderly were found abandoned in care homes. Meanwhile, from other scenes from Spain, we have this video by a dweller there.
I have been living here in Spain for more than 7 years now. As you have heard from the media, that the situation in Spain is not that good. Above all things, Madrid, the capital city, is the one that suffers the most. The numbers of coronavirus cases and death tolls have soared dramatically in the last few days. The Spanish hospitals are overflowing, so the hotels and big convention centers are now transforming into hospitals. The government declared the state of alarm, which is the first state of emergency level, more than 10 days ago, and today they have extended another 15 days more. Under the quarantine rules, people are not allowed to leave their home except for any emergency, such as buying food, or going to pharmacy or hospitals. Look at this. This is Sunday afternoon. Normally there are a lot of kids playing soccer in the park and a lot of families come out and walk around. But only with the dog, one person can go and take a walk. We bought some water, toilet paper, milk, and some food just to survive a few days more because we are still allowed to go to the supermarket. But I'm not sure until when. There are several reasons for the outbreak of coronavirus in Spain. Number 1. Spain is one of the top travel destinations for global tourism. More than 80 million people visit Spain per year. Number 2. Spanish people are very social. Shaking hands, cheek kissings, huggings are very usual for Spanish people. So social distance has been very difficult for them to accept. 3. There were 120,000 people gathered in Madrid on International Women's Day, which was March 8th. A lot of politicians got positive on the coronavirus test after this event. The Spanish government is not only worried about the virus itself, but also they are worried about the economic situation because most of the businesses are now paused. The government announced that they will spend 200 billion euros or 20% of the GDP to fight against coronavirus and economic recovery. The Korean Embassy in Spain, Korean Association, and Korean community websites such as SpainAgain.net are updating the latest news of coronavirus for Korean people in Spain. Families who have lived for long years in Spain are not willing to go back to Korea, but those students without families or expats are seeking time to go back to Korea. Every day, 8 in the afternoon, everyone come out to their balconies to applaud the medical staff who are fighting against the coronavirus. I understand that everyone, not only in Korea, nor in Spain, but also around the world, are going under a very difficult situation. But I wish we never give up. As we have overcome all the hard times in the past, we will solve this issue all together. I give special thanks to those people who have sacrificed their lives for the others. Thank you very much.
Now that is a heartening show of solidarity in Spain every night at 10, with people literally applauding endless efforts by healthcare professionals in their war against COVID-19. Thank you again, Denny Han in Spain, for the footage. And to our viewers here and elsewhere around the world, should you have scenes of support that you would like to share with us, please feel free to log into our website at arirang.com.
비상금융 조치를 대폭 확대해 100조 원 규모의 기업 구호 긴급자금 투입을 결정합니다.
We are living through an international economic crisis in the wake of COVID-19. Now, some pundits say the crisis will be more severe than that of the year 2008. Accordingly, the Korean government has laid out some emergency economic countermeasures. And might I add, the word emergency was used 14 times by President Moon Jae-in during a cabinet meeting earlier last week, showing his administration's determination to take the lead on the economic front in the battle against COVID-19. On Tuesday, he pledged a rescue fund of 100 trillion won, about $80 billion US dollars. We have two economic experts here in the studio to join us and share their thoughts on the latest efforts by the government. I have Dr. Kwak Soo-jong and Bruce Lee. Welcome.
Thank you very
Bruce
much.
Han, that is, excuse me. Right, and Bruce, I was going to ask you, as I mentioned earlier in the lead, some are saying that the current crisis will be far worse than that of the 2008 financial meltdown.
Yes.
How do you assess the current financial market?
Yes. So I'm not making light of the current crisis right now, but it's very different from the 2008 financial crisis. That was a real crisis. It was leading to a systemic problem, systemic risk. What was going on in the US was that they had problems with the mortgage market, subprime market especially, and unethical mortgage lending practices. So a lot of the mortgage lenders that were involved in these practices, they started going belly up. And then the investment banks that issued bonds for these mortgage lenders started going belly up as well. And it just started cascading. Now, Korean investors at the time, they were somewhat protected because they weren't big holders of subprime CDOs. It was quite manageable. But it was part of the international markets, obviously. So Korean institutional investors had a hard time raising capital, buying US dollars. So what the US government did was they went on a massive buying spree. They put massive amounts of liquidity into the market, TARP, the various QEs. It took about 9 months, but then the market recovered. Now the current crisis, it is a crisis, but it's a crisis of confidence. It is not a financial crisis. This is not leading to systemic risk. The banks are well capitalized. Everyone learned, especially the Bank of Korea, from the events of 2008 and even 1997. So I think that the government is doing an excellent job right now in calming fears in the market. And I think last week when they cut rates by 50 basis points, bringing the policy rate down to 0.75%, I think that was a really good move. That was the first emergency meeting, as you know, since 2008 global crisis. And I think the government yesterday, implementing the 100 trillion won policy, I think that was a really good move as well. So what the government is doing right now, in tandem with global governments, global central banks, they're easing the market. They're easing the fears in the market right now. But the problem right now is that we don't know when a vaccine will be created. And it looks like in the US and in Europe, things are just getting underway right now. So I think it's safe to say that during the first quarter, we're definitely going to have an economic downturn led by China and Korea. And then the second quarter, I think led by the US and Europe. But I think all the experts are saying that this won't last for years and years and years.
I see. Well, Bruce talked about a crisis of confidence, but we are witnessing declines in several markets, I mean, including retail, distribution, tourism. What are your thoughts on this?
Well, Mr. Han summarized the difference between the 2008 financial crisis and recent crisis. I agree with that. This is not basically the economic crisis itself. It is, economists usually say this is exogenous variable. In fact, this COVID-19 is not economic factor at all. So we are not allowed to talk about the economic factor of COVID-19 to the economic business cycle. Definitely, however, we are witnessing this virus is affecting the economic activities through all the value chains, for example, demand, supply, and even the financial markets. So this is kind of thing that has been caused by non-economic factor, which is called COVID-19, but is giving us a heavy trouble fixing all the business cycles, which had been very softly running through before this happened. So I make some analogy. This is the thing that happened like a turbulence while we are traveling through the airlines. Usually the economic situation look like a cycle, sine graphs or cosine graphs, smooth and up and downs. But this COVID-19 created us a turbulence which is not expected. So we should at this point expect the unexpected always. That is the problem, how we can handle with this one. And the government now have only two tools, financial tools, monetary policy, and a budget, fiscal policy. So they are now giving all the bullets to make the economic crisis a little bit soft landing type of slow down kind of effect, instead the hard landing. I think that's the reason why we are doing this.
And speaking of that budget, the National Assembly passed a supplementary budget of $9.8 billion US, and this passing took place in just 12 days.
Yeah.
Where and how will this supplementary budget be used, Dr. Kwak?
Well, government already had a first and second emergency meeting. So they announced, they publicized all the use of these monies to support the small, medium-sized commercials and the big medium-sized enterprises and even the financial institutes. So government is ready to figure out which part or industries are best need to keep the employees and to keep the people keep moving. So government is now telling us that they're going to spend $9.8 billion to support this one, and they made a quick decision within 12 days. The United States is still struggling to pass the $2 trillion value of supplementary support for this kind of event. Korean government is very swift in a sense to feed the financial markets or the manufacturing markets emergency situations. For example, government said next year they're going to put in about $400 billion as a budget, annual budget, which is, I think, at least the $5 billion higher than this year. And they also put the $60 billion swap with the United States Fed. So all this money supply is preparing for the bullets in case something financial market has some troubles to save them. And the next problem is how as you mentioned at the first question, how are we going to save all those tourisms and parts and the manufacturing side? That it depends on this demand side. Demand would not be recovered unless vaccine is developed or this virus disappears natural order by the time the temperature goes up. So we are crossing fingers until we see 3 or 2 ways of solving this problem. Number one, we should live with the virus forever. Number two, we have to develop some vaccine to heal this trouble. Number three, we expect the COVID-19 has a life cycle too, so it will disappear as temperature goes up. So 3 base scenarios make all these supplementary or grants, government aid type of amount is summing up these days.
And from your 3 scenarios, I like the last one better, I think. Bruce, as Dr. Kwak also mentioned, initially the rescue package of 100 trillion won was supposed to be half that sum. This was agreed upon during the first Economic Council meeting last week. But yesterday, that's Tuesday, President Moon Jae-in raised that sum. Why do you think that was the case?
Well, it's simple. Right now, companies aren't making money right now. They have expenses to pay like salary and other operating costs. They have to borrow money as well. And they can't go to banks or the capital markets at this point. So they're facing a challenge. And if this continues, the companies will go bankrupt. Currently, the local debt market is not working properly at the moment. Most Korean companies that need to raise money, they have low credit rating, B, BB, BBB ratings. And so they're facing a fundraising challenge right now. And so capital costs have risen dramatically. For instance, like the airliners, like Korean airline bonds, they're trading at like 7-8% right now. Asiana airline asset-backed securities, they're trading at like 12 to 13%. So they're facing a liquidity challenge at this point. So what I think the government did yesterday, which I thought was a really good move, was that they're focusing on helping these sectors that really need financing right now, the hard-hit sectors like airlines, tourism, autos, the various retails, because banks just aren't lending to them or extending maturity at this point. And so the main policy, I think, is directly towards helping the small and medium-sized companies, the small mom-and-pop store owners, the entrepreneurs, and another target is stabilizing the capital market. right? So the capital market includes not only corporate bonds, commercial paper, but also the equity, the stock market as well. So if we look at the numbers right now, the corporate direct lending guarantee makes up about 58 trillion won out of the 100 trillion won. The capital market assistance is around 42 trillion won. And to be a little bit more specific, because this is a really important topic, 42 trillion won capital market package. Out of that, 31 trillion won is for corporate bond market and the short-term commercial paper market, and the remaining 11 trillion won is to stabilize the stock market. So the government is going to establish a stock market stabilization fund. I don't know if Professor Kwak agrees, but a lot of analysts that I've talked to, they're saying that that might be a little bit small amount to prop up the stock market, because as of yesterday, today we had a nice pop in the stock market. The total market cap was about 998 trillion won yesterday. So 11 trillion to help a 998 trillion won market, it might be a little bit too small. And as you know, this isn't a complete rescue package. As Professor Kwak said, this is to get us over the hump right now. It's to get us over. And this isn't going to last forever. So like the ECB, they're buying up government bonds again. The Federal Reserve, they're buying aggressively bonds, mortgage-backed securities, even commercial paper. And I think there's still room for more stimulus, because if you look at the ratio of Korean government debt to GDP, it's only around 40 to 45%, which is much lower than the US and Japan. And please keep in mind that Korea is not the only country going through this right now. We're all going through this together. So I think all the various governments and central banks injecting liquidity into the market, I think this is a good thing. And I think the Korean government is showing that they're willing to intervene aggressively to support the capital market, the various Korean corporations, and to support the workers as well. And I think, as Professor Kwak mentioned, the recent Bank of Korea's currency swap, it's double the amount which compared to 2008. So, and I think this also shows the strength and friendship with the U.S.
The difference between 2008 currency swap and this year's, last 2 days before, we had a swap with the last week, United States. Difference is 2008 we asked to United States.
Okay.
But this time US gave us the swap opportunity. United States Fed not only gave Korea but also 8 other countries all together at the same time. This gives some kind of implications, what's going on in the globalized situation. Some newspapers said headlines that this kind of symptom, coronavirus 19, is a test for globalization in 21st century. In other words, most of the value chains are linked together from United States to China or to Bangladesh. Every part of the world is now linked. One area, if there is a small problem or bleak, then the rest of the chain would be bleaked or cut off easily. So United States is figuring out this kind of matter, very importantly and very seriously. So United States gave us an opportunity to cool down the Korean economy, not because their economy is safer than the Korea's economy. In other sense, United States economy is also US would expect the similar procedure as Korea's economy is now facing. In other words, financial markets, lots of corporate bonds and commercial papers. For example, energy industry side, the shale gas side, they need a huge amount of money to support all debts. Corporate debts this year is about $63 trillion. In 2008, it was only $33 trillion, so doubled. So those corporate debts give us a heavyweight trouble to United States, and US have that kind of trouble. They will suck up all the monies from the foreign countries which they had been invested. If that happened, then as Mr. Han said, liquidity problem would happen, and that will cut off all the chains, value chains between the financial market and your market, the material market. So this is the problem we are facing now.
I see. Bruce, there was
Yes.
talk about a disaster basic income. It's like an initiative allowing, offering like the public, members of the public, an allowance to ease the burden of the current COVID-19 pandemic. How do you see this policy as unfolding? I mean, Gyeonggi-do province
Yes,
has
that's
pledged
right.
to put into action.
That's right. So I think basic disaster income is crucial for the lowest wage earners, for the elderly, for those who got fired, who need money the most. And I think those who are looking for employment right now, I think it's really important. And other countries globally are implementing this policy. So for instance, recently the Hong Kong government, they're going to give US $1,400 to all Hong Kong permanent residents, even those living abroad. And as Professor Kwak mentioned, the US government is still working through details right now, but it looks like they'll give anywhere between $600 to $1,200 to citizens. Now, that might not sound like a lot of money, but shockingly, 80% of Americans surveyed said that they will have difficulty getting $400 together for some kind of emergency. So if you put it in that perspective, I think it's a good thing. But I think, as you mentioned, the Gyeonggi deal yesterday, I think if you give it to everyone, it might not be as meaningful as maybe giving it to the ones who really need it the most. So at the individual level, the amount is quite small, 100,000 won, like 79, 80 US dollars. And if you multiply that by 13 million people living in Gyeonggi province, that's 1.3 trillion won, which is about $1 billion, right? And I know that the local governments and the federal government, I know that they're doing a really tough balancing act right now, helping out the poor, helping out the needy, but at the same time handling the corporations as well, right? So I think maybe, although the heart's in the good place, the motivation is good, but maybe we should focus on giving that money to the ones who really need it, not to everybody. And secondly, I think the government should still focus a lot of their attention on helping out the corporations, especially the small and medium sized enterprises.
Right, I couldn't agree anymore. Right, I agree completely. Unfortunately, that's all the time we have for today. I mean, we could talk about this all night, but for now, thank you very much, Dr. Kwak Soo-jong, for being here, and Bruce Han for being with us today.
Thank you very much.
Well, like I said, that's all the time we have for today's coverage of COVID-19 pandemic. We'll be coming to you live on a daily basis at this hour, so do join us for more on the latest events on the coronavirus here and elsewhere. In the meantime, we welcome your messages, feedback and questions with regard to the COVID-19 outbreak, so be sure to check out our homepage at arirang.com or follow us on our social media accounts. Also, as I mentioned earlier, if you have any scenes of support that you'd like to share with us, feel free to log into our website. Thank you.
The entire world is in the doldrums because of COVID-19, but there are some who are rolling